precocious puberty. This is what we talked about earlier. It's when you start to have sexual development before the age of 8 in females and before the age of 9 in males. Definitely more common in females than males. Manifestation of, again, sexual development. And the problem with this is, psychologically, it can cause a lot of problems for the girl because bullying, being made fun of, especially when you have somebody that's maturing much quicker than the classmates. And also there's a concern about sexual abuse, as I had mentioned before. So most of the time they don't know what is causing it. But again, the major concern, and also the rapid bone growth can occur, but then tapers quickly too, so they're shorter stature ultimately. They can have headaches and seizures, and again, the emotional effects of it. Sometimes it can be CNS tumors, but a lot of times there's no cause. Could be tumors of the ovaries and testes also that we have to look at. And if it's an underlying tumor, obviously you want to treat the tumor, remove it. Otherwise, what they do is they give something called, it's a gonadotropin releasing hormone, agent that blocks the release of this. So what it basically does is it decreases the amount of luteinizing hormone and follicle stimulating hormone that's released from the pituitary gland. And if it decreases the amount that's released from the pituitary gland, it therefore will decrease the stimulation on the ovaries or the testes, therefore decreasing the development. Does that make sense? Mm-hmm. You see what I'm saying? Yeah. So it's stopping it at the pituitary level with the release of that luteinizing hormone or follicle stimulating hormone. It's actually decreasing the release of that pre-hormone. Therefore, it won't have an effect on the ovaries or the testes to release the sexual hormones. And it usually takes 2 to 4 weeks to come in, to start to take effect. And they have 2 ways to do it. It can be given intranasally, twice a day, or IM monthly. So somebody would say to me, well, if it can be done intranasally twice a day, why would anybody go in for the IM monthly? These young children. Compliance, that's right. Stephanie said compliance, and she's right.
Or if there's anything wrong with passage that they...
That's right. If there was a problem with the nose, polyps or something, but for the most part it has to do with compliance, because depending on the family situation, it's taken in the morning and at night. So you need somebody, a parent usually, because these are young children, to say, okay, did you take it? Let me give it to you, let's do it then. And if you have people that might not be compliant, even with losing 1 dose, it's going to kind of trigger that to occur again. So, and then it's not good for them to be triggering it, stopping it, triggering it, stopping it. So you want to keep it consistent. So even sometimes the families that just do the 1 IM monthly, because then I know I have an appointment every month, we go in, we get the injection, and it kind of puts it all dormant. This is actually how a lot of birth control works too, even. So it kind of can make everything, what I would say, dormant, or stop the release of this hormone. And then what they do is they remove it, usually in a few years. They try not to wait. So if they were like 8 or 5, 6 or 5, whatever age, sometimes they're even younger, 4 and 5-year-olds even, they'll wait till they're about 9, 10, and then they'll remove. So it'll still be a little earlier, but it won't be as bad as if they're 4 or 5. And then they'll go through puberty then. Thyroid, okay. I know you did hypothyroidism. Yes, Bill.
So is this separated from just having early puberty? Like, because this mentions like treatment like for a tumor and stuff like that. Like, I mean, they're saying like certain cases of kids having hitting puberty at 9 now on their own without any tumors or anything like
That's
that. So
right.
are they still?
They are doing that, yes.
So they still do this even without the tumor?
That's right.
Like
In fact, if it is a tumor, they're going to remove the tumor. That usually solves the problem. So yeah. So this is if they're just getting it on their own without any known cause, which a lot of times is happening. They are looking at, to go back again, and I know you probably see it on all the milk bottles, but they're saying like no hormones, because they were finding, there was some research that was coming out that was finding that the hormones they were giving to these cows were actually going through to the children, and therefore could cause increased development. So that was one of the thoughts there too. Okay, I know you talked about hypo versus hyperthyroidism in your other class, right? Let's take a moment to review that. Hypothyroidism, when it's acquired, is very similar to what you learned about in 132 with adults. So what are the signs and symptoms of hypo or underactive thyroid? Lower T3, T4 levels. Low metabolism. Sluggishness. Gaining weight. Bradycardia. Always cold. Everything slows down, exactly. That's right. What do we do for, and the common cause in children when they get it and they acquire, is something called Hashimoto's thyroiditis, which is an inflammation of the thyroid. It's a viral, and sometimes immuno, like one of these immune things that causes, again, almost like a, very similar to like Calvé-Perthes or one of these, where, and their immune system actually attacks the thyroid and it doesn't make it as active. So they have lower levels of thyroid hormone, T3, T4. And when that happens, again, you have this cycle happening. So what do we do for people who have this? Same as we do for adults. What do? Give Synthroid, right? That sounds familiar, Synthroid, right? Daily, rest of their lives. Very little side effects, not much of a problem, right? For women, you know, if they do have low thyroid, it can actually cause problems with even getting pregnant, keeping a pregnancy. So again, it's important that it gets diagnosed. Things like goiter, you could see actually in either. What is goiter? Enlarged thyroid. Good. So again, levothyroxine or Synthroid, right? Lifelong oral. All right, I'm going to skip congenital for a minute because I want to talk about hyperthyroidism or Graves' disease. Because again, this is similar to adults. Hyperthyroid, okay? Exophthalmos, yes, protruding eyes, thin, increased activity, increased heart rate. What is the issue with this? Heat intolerance, it tells you all those there. What is the issue with this? Why it can be so scary? What can happen with this? That's right, thyroid storm. What is thyroid storm? What is thyroid storm? If you manipulate the thyroid gland too much, especially if they're going to remove it, or doing something with the thyroid gland, if it gets manipulated too much, it can actually have an excessive release of hormone, which can actually put the person into a heart attack. It can actually increase their heart rate so much that they're at risk for a heart attack or a stroke. So these are very scary situations again. It's funny, but what is usually the gland we lose when they do thyroid surgery, remove the thyroid? The parathyroids, and they're involved in what? Calcium. That's right, the metabolism of calcium. Therefore, we can see hypocalcemia, right? So then you can, and obviously the signs and symptoms do the Schaff's text.
Is that what this is? What MSBC?
You want it,
How would
right?
you do that?
It's very hard to. Usually they don't. When they remove the thyroid, you lose the parathyroids, and therefore you have to watch for calcium. Calcium metabolism, not so much even just giving calcium, but the metabolism of it. Again, though, usually with a increased thyroid hyperthyroidism, they do a partial or subtotal thyroidectomy. The partial or subtotal thyroidectomy, Stephanie, would help to save the parathyroids if they were worried about it. And sometimes they will even inject with this Lugol solution, which will decrease the vascularity, because the thyroid is an extremely vascular gland. So when they remove it, there could be a lot of bleeding. That's the concern too. And then after they remove the thyroid, then what do? Give Synthroid, because you're going to have hypothyroidism then, right? So the issue we talk about that's kind of new here in pediatrics is congenital hypothyroidism. What was happening is that there were infants that were born, newborns, who were born either without a thyroid gland or missing part of their thyroid gland, or a thyroid gland that was not active or working. And T3 and T4 actually increase neurological development and help to provide support for normal neurological development in a newborn. Okay, when they don't have a mature neurological system, they actually foster this neurological development. So what was happening was, before we did screenings, we would have these newborns who were born. I went back in, yeah. We had these newborns that were born that had non-functioning thyroid or low-functioning thyroid that were starting to have neurological deficits that were seen somewhere between 3 to 6 months of age. They were not progressing as they should, even though they were born normally. Because they didn't have T3, T4, so they're born normal. But due to the lack of T3 and T4, they start to lose their neurological functioning, and it becomes permanent. So even if you start to give them Synthroid and increase their T3 and T4 levels, they already have permanent damage. Like and they have pictures in the book actually, like they can have all the sluggishness, but then they can also have mental retardation issues, lowered IQs, problems with motor control. If this is not, so now what we have, the good news is what we now have is screening, mandatory newborn screening, that's usually done right before discharge to check their levels of T3, T4. And if they are low or if it's non-existent, then you would give Sim for the rest of their life. So that is a little bit different from regular hypothyroidism. If they're born with a non-functioning thyroid or no thyroid, they need to have a test screening, because otherwise they will progress and go on to having permanent neurological deficits. Oh, and this just talks, remember Trousseau's and Chauvetek's sign? Those sound familiar? Good, which one? And that goes back to how I remember things, Stephanie. Chauvetek's, and I know I'm probably saying his name completely wrong, but is cheek. Think C and cheek. So when you tap the cheek, what happens? On the other side. That's right, you have a twitch on the other side. What's Trousseau's? Anybody remember that one?
That's the tension with the pressure on the,
Blood pressure. You take somebody's blood pressure, take the systolic up, and then what you start to see is a twitching on the side that you're doing the blood pressure on. It'll go like this, their arm. And tetany, I know you always hear about tetany, like muscle contractions and all, painful. That can be another sign of hypocalcemia. Okay, Inyo, tape, because we're one last.